from Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us as we discuss weight loss medications and the healthiest approach to them. Our first guest today is Dr. Karen Hamid, Associate Chief Medical Officer for SMH's First Physicians Group Primary Care. Dr. Hamid, thank you so much for joining us.
Happy to be here. Thank you.
Weight loss medications seem to be everywhere right now, and everyone's talking about them. So can you start with what exactly are GLP-1 medications and how do they work differently from traditional weight loss approaches?
Sure. There are very scientific explanations, but I'm going to try to put it in layman's terms so that everyone can sort of understand what we're talking about.
Yeah.
GLP-1 receptor agonists are medications that are incretin-based hormone therapies or peptides that mimic the natural physiologic response to eating. So when we eat food and have a meal, our bodies release hormones that tell our brains we're full, that tell our stomachs we're full, and those feelings and sensations last for a certain amount of time, and it's person dependent. When those feelings wear off, you're hungry. You have food noise. You're thinking about what to eat next. These medications are synthesized to do exactly the same things that those hormones do. So for example, they work centrally in the brain, in the hypothalamus. They tell your brain that you're full, which we call increased satiety. They also tell your brain that you're not hungry, which is a little bit of a different mechanism. And then lastly, they work locally in your gut to slow your gastric motility so your stomach actually is full longer and those sensations last as well. So the combination of all those three things in your brain and in your stomach make you not hungry. They decrease your appetite, but they also give your body more time to absorb the nutrients that you're eating. And because they're synthesized, they make them to last longer. So their half-life is longer. So sometimes they even last up to a week. That's why the injections are given weekly and the oral pills are given daily. So rather than you eat and an hour later you're like, ooh, I'm hungry, now you take these medications and those responses to the hormones last longer.
So in discussions of GLP-1s, we hear things like semaglutide, tirzepatide almost all the time. So what's the difference between these medications?
That's a great question. So tirzepatide is actually a combination of two incretin hormones, GIP and GLP-1 receptor agonist, or RA. Those are the two hormones that our bodies release in response to eating and that work synergistically to help your pancreas handle its glucagon and insulin responses to food, slow your stomach emptying so you can absorb the food, tell your brain you're not hungry, etc. So the tirzepatide combination actually is the most physiologic-like to what normally happens when you eat. That being said, the semaglutide is solely a GLP-1 RA, but it is very close to tirzepatide. And so while there might be a little bit more weight loss with the tirzepatide than the semaglutide, clinically speaking, really the results are pretty much the same.
So how do you help patients decide which is right for them?
To be honest with you, a lot of that is cost, what they can afford and what their insurance will cover. I mean, there are specific indications for specific healthcare problems that we're going to talk about a little bit later the studies have been done specifically for that medical problem. So for example, Wegovy has been approved for sleep apnea. The company of Wegovy did the studies on sleep apnea, so they get that indication. But in terms of weight loss, really it's a matter of what can they afford, what's accessible to them, and maybe what their insurance will cover.
And you mentioned the injections versus the pill. I know the pill is newer,
yes,
but are they equally effective?
They're actually not.
Okay.
So for example, the injections are more potent, I'm going to say. They are stronger, they last longer, and they're not as reversible. If you take a pill one day and you don't like it, you don't take it the next day. If you take an injection, you're kind of with it for the week, if that makes sense.
Mm-hmm.
The effects of the injections are stronger, and the weight loss, they talk about weight loss over 72 weeks, and if you think about that, that's over a year. So the oral pills are now promising an 11% reduction in weight in a 72-week period, whereas the injections of tirzepatide and semaglutide have a higher percentage of weight loss in a shorter amount of time.
So who is an appropriate candidate for these medications?
Another great question. So overweight patients who have struggled with weight loss over the years. So I have a lot of patients who have tried diet, exercise, trainers, fad diets, all the things that you can see on TikTok and social media, and yet they may get 10 pounds off, 20 pounds off, and then boom, rebound. So I think these medications have really found a way to help motivate people, give them a kickstart, so to speak, get a significant amount of weight loss going so that they can work on the habits that will help maintain their new healthy status.
Are these drugs offering any other health benefits?
Definitely. And I think more to come on that also. I keep waiting for the shoe to drop, so to speak, and for something bad to come out, and everyone keeps saying they're new, but I really haven't encountered anything too terrible, which is a great thing because a lot of patients are taking these medications. These medications have health benefits for patients who have diabetes. They improve kidney function. They have health benefits beyond just the weight loss. In patients with diabetes, cardiovascular disease, they help with sleep apnea. They help patients with fatty liver. They help reduce the fat in the liver. They help regress fibrosis, which is pretty amazing.
Yeah.
So there are a lot of different serious health conditions that these medications have been found to improve besides obesity.
And have you found patients are able to come off of other medications?
All the time. Most of my diabetic type 2 patients have come way down on their metformin, come off their glimepiride, and it's actually great. And a lot of blood pressure medicines come down. We tend to keep them on their cholesterol medicine because there's a lot of other benefits to that. But I've seen a lot of patients come off their diabetic medicines and their hypertension medicines successfully.
How do you counsel patients, though, about setting realistic expectations? Because this is not an easy button.
No. And that, I think, is the risk, right? Is that people use it as the crutch or as the sort of way out. And you can eat through these meds and you cannot lose weight and take these meds, which I always tell patients, that why are we doing this, right? If you're going to find a way to cheat, you're cheating yourself. What I do when I start talking to a patient about these medications is we look at their weight, we look at their BMI, we set realistic goals of weight loss, and we talk about ways to hardwire the lifestyle modifications that they've been too hungry to focus on. So that food noise, that's a real thing. And patients can't really get out of their own way with that. So when these medications take that off the table, then they can make sure that they're getting to the gym 3 to 5 times a week for 30 to 45 minutes of cardiovascular exercise every time, that they're eating on a salad plate, not a big dinner plate, that their portion control is appropriate. I recently spoke to an endocrinologist who said, really, we should never put more food in our stomach than is the size of a fist. We should never let our stomach get more distended than the size of a fist. And that's actually a good rule of thumb. People can visualize that.
Makes sense. You did mention some side effects.
Yes.
What are the most common side effects and how can patients minimize them?
So the most common side effects are GI. Nausea, constipation is a big one. Not so much diarrhea, but really the nausea, abdominal discomfort, and constipation. So everyone is going to get constipated. I tell them that from the minute one. And I actually, when I write the prescription for the medication, I also tell them what stool softeners to get, and if things get extreme, what laxatives to use, just to get them going, because the body is responding, your gut is slowing down significantly, and you're taking in less calories. You have to remember to stay hydrated. That is a huge piece of this. And the abdominal pain and the nausea, it's interesting. For the most part, I have found that if you overeat, you're going to feel it. So what I counsel my patients is eat a few bites and take a pause. And if you're full, be done. You don't need the second piece of pizza because you always eat 2 pieces. Now you don't have your body saying, I need that second piece of pizza. Those are the situations where people really get, I feel, the abdominal pain. I mean, there are some people who just don't respond well to medications or have side effects. But in general, rule of thumb is if you're having some GI symptoms, you may be eating too much at one time.
There are also concerns or chatter. There's been talk about muscle and bone loss.
Yes.
How do you counsel patients about that to prevent it?
Sure. So again, these medications have been all the rage at all the medical conferences. And recently I was at a conference where they were addressing this very issue. And the studies actually show that while you do lose muscle, pound for pound, you're not losing more muscle with the weight loss you experience with these medications than with weight loss you experience in other ways. So if someone was extremely successful on Weight Watchers or with a keto diet, they would lose as much muscle as they're losing with this. It's just that they're more successful in the volume of weight loss they're losing, so it's a little bit more prominent. So how do we avoid that, or how do we mitigate it? I think the 2 best things that we can do, which I tell all patients from the start, is you make sure that you eat your protein first. You want to be eating 0.5 gram to 1 gram per kilo of body weight of protein every day. So if you're a 50 kilo person, then you want to be eating 25 grams to 30 grams of protein a day. And also you want to be lifting weights.
Yes.
That's very important.
Are there people who should not take these medications?
Definitely. There are contraindications to these medications. I hope I can remember them all. Pancreatitis, gastroparesis, a family or personal history of medullary thyroid carcinoma, or something called multiple endocrine neoplasia type 2A or 2B.
Okay. And that's just because the medications will interact poorly with them?
Yes, the medications may trigger those types of physiologic
Got it.
concerns.
Why is it important to take these medications under medical supervision rather than purchasing compound products or obtaining them through non-medical sources?
So people are doing that all over the place. And some of them are having great outcomes. But I really feel like your doctor, especially your primary care doctor, is really the place for you to start exploring these medications, because you want someone who can help, first of all, log your weight loss, emphasize and reinforce the lifestyle modifications that you're giving yourself the room to hardwire, I like to say. So we check in on a monthly basis, whether it's in person or telehealth. We check a weight, we talk about how much exercise we're getting, we talk about how much protein we're eating, how many weights we're lifting, et cetera. And also we talk about side effects and we help mitigate the side effects. The compounds, first of all, you're not positive what you're getting. And I feel like some of those companies may be prolonging the need to keep paying out of pocket for those substances, if that makes sense. I don't have much to corroborate on, but when I do the math on patients that I know that are doing the compound and they're getting it by the unit, or it's a much lower dose than what the pharmaceutical company actually recommends as the therapeutic starting dose and follow-up doses. So I just think if you're working with a doctor and you can get the real medications that the studies are on, that's just always a better fit.
And I understand these medications are becoming more accessible because Medicare is now covering them.
Yes. So Medicare is covering these medications in a variety of ways, but the buzzwords now are the Medicare GLP-1 Bridge program.
Okay.
So just to touch on that for a moment, Medicare does cover Mounjaro for diabetes and Wegovy for sleep apnea, but those are different processes, and your specific Medicare plans factor into whether the ease with which you can get those. But the Bridge program is a pilot program that Medicare has started. It is a pilot for 18 months that they will charge the patient $50 a month for any of a variety of the medications. This is for weight loss only. This is not if you have sleep apnea, diabetes, or fatty liver. Those are exclusion criteria. You also have to have Medicare Part D. If you don't have Medicare Part D, Your provider can't do anything about getting you those. And then there are BMI criteria. If you'd like me to go through those, I can, but you have to have specific BMIs with concomitant medical problems to qualify for that bridge program. But it is a thing.
So, and someone's provider could
The
walk
primary
them
care
through.
doctors walk them through. We have, especially at FPG, we have people dedicated to helping our patients get these medications, see if they qualify, helping the doctors get through the prior auth. It's a process, but we have worked out a nice pathway to help our patients get these medications at a reasonable cost.
And so for those patients who truly need the weight loss, this is great because now they are closer to being able to afford it.
Right, and this was a gap, which I'm actually pretty proud that Medicare recognized, because I had a lot of patients who were obese, but didn't yet have type 2 diabetes, didn't yet have their heart attack, didn't yet have the fatty liver, and nobody was covering the medication for the weight loss. So this is purely to help patients who are overweight and obese with comorbidities get what they need before they develop those serious end organ situations.
Many people worry they'll regain the weight if they stop taking the medication. Is that always the case?
They will regain some weight.
Okay.
Because the medications are suppressing your appetite and your food noise dramatically. And so that is why it's really important to use the time wisely that you're on these medications to hardwire the lifestyle modifications that the majority of patients weren't able to focus on before they were on the medication. I think it's unreasonable to imagine that you won't regain any weight because you're going to start eating a little bit more than you would on the medication. But hopefully you're going to be eating a reasonable amount of food in reasonable intervals. You'll have learned to manage diet, exercise, keep active, and you'll have trained yourself to not eat more than a fistful of food. And that will help, mitigate what could be seen as a rebound effect when you stop taking the medicines. And then, to be fair, there are many doctors who are working on maintenance plans for patients. So maybe you take a much lower dose at a longer interval. These are all sort of off-label microdosing conversations, but doctors are figuring out how to make that work for their patients. And maybe it's a low dose once a month, or maybe it's a lower dose every other week. But there's options so that it's not this dramatic rebound effect.
When you start your patients on these medications, are you starting them with the goal of eventually getting them off them, or is this a lifelong?
That's a conversation we have with the patients. I have patients who have struggled with their weight their entire lives. And to see the joy on their face when they actually are losing some weight in a safe and medically guided way, it's really satisfying, actually. And so, I haven't been at this long enough. We've only had these meds for a year and a half or so. I've had patients lose 100 pounds. I've had men tell me that they can take their belt down from, these crazy wide belts to like a normal belt loop. Just some really nice stories. So I try to encourage them to not be discouraged if we do have to stay on some version of the medication for the long haul. People have to stay on blood pressure medications. People have to stay on diabetes medications. And if we were able to get you off 4 blood pressure meds and 2 diabetic meds, so maybe you take a shot once a month. And I don't think that's really a negative outcome. But I also have patients who are a little bit in the younger population who really are able to get their lifestyle stuff in gear and get off the medications.
So it really is a
case
plan.
by case.
Yeah, patient by patient.
Yep.
And that's why it's another great reason to go through your physician.
Exactly. And we're flexible. This is not a sum game, right? We move with the patient.
So if someone is curious about these medications, what's the first conversation they should be having with their physician?
I think just being open about their struggles with weight loss, telling the doctor what they've tried, how long they've been at this, their successes, what worked, what didn't work, what motivates them, and just opening the dialogue. Most primary care doctors, I would say, if not all, are very much expecting these conversations. And like I said, it brings us joy to help our patients and to move the needle and to see somebody finding success finally after, maybe decades of feeling like they're not good enough at this. It's just nice for all of us to have a win.
Dr. Hamid, thank you so much for joining us. Our next guest today is Micah Ipri, registered dietitian and program coordinator of the Renew program. Micah, thank you for joining us.
Thank you for having me.
What's the biggest misconception about medical weight loss that you want to correct?
I think it's that these medications do the job all by themselves. Really, it's not a replacement for healthy habits and healthy lifestyle, but it's a tool to help those habits become easier. It's not either or, it's yes and. So we see that when people are, they have less cravings, they're feeling better in their bodies, they're able to exercise more, they sleep better, they're able to feel more in control around certain foods and beverages. So it allows these healthy habits to really come through.
So when someone starts a GLP-1 medication, how should they think about food differently?
They do need to think about food differently. So when your appetite is decreased, which it is for many of these people on the medications, every bite has to have more intention behind it. Whereas before, when you had a larger appetite, throughout the day, you managed to hit your nutrient needs. But when you're eating less, you need to have more strategy behind what you're eating. So really, it's flipping the thought of food around, seeing it as fuel and seeing it as a tool.
What nutrients become the most important while taking these medications?
So we, in the Renew program, we like to call protein and fiber the kings and queens of nutrition. Okay. So protein, of course, is going to help us preserve our muscle mass, protect your muscle while you're losing weight. And then fiber is going to help with a lot of the side effects that we see from the medications, like the constipation and nausea. And also when you're eating foods that have fiber, like fruits and vegetables and whole grains, you're getting vitamins and nutrients that you need. And then, of course, hydration as well is really important.
How do you recommend people get these nutrients? I mean, what are the healthy ways to get good protein, good fiber, and help keep your body sustained?
Yeah. Well, from a standpoint of what to eat, for the protein, we want to choose lean meats. Fatty cuts can trigger some of that nausea and reflux, so you do really want to choose lean meats. Things like Greek yogurt, cottage cheese, eggs. Your plant-based proteins like your beans are also going to introduce some of that fiber. Fruits and vegetables, like I said, whole grains, and really limiting the greasy foods, the fried foods. Even too many good fats can sometimes cause nausea and constipation for people. So focusing, again, on a balanced plate between the protein, your fiber, your whole grains, and really we want to not rely on hunger cueing us in that we need to eat. Previously, before medication, your hunger told you, it's time to eat. And throughout the day, if you're waiting for your hunger to signal that, what ends up happening is something that I call accidental underfueling. If you're waiting until the end of the day to really feel those feelings and, to have that signal, accidentally, you're missing a whole window where you could be getting those nutrients in, and it's really hard to catch it up at the end of the day. So from the people that I've worked with who, prior to having guidance, who were just figuring this out and trying to wait for those hunger cues, they weren't getting enough protein. They weren't getting enough fiber. They were just eating what was convenient and easy, and accidentally missing out on all these other benefits.
Are there certain foods that people tend to tolerate better or worse while they're taking these medications?
Yeah, everyone's a little bit different, but in general, people tend to tolerate lean proteins and fruits and vegetables and whole grains in general, and fatty foods, high-fat fried foods, large meals tend to make people feel worse. So we always recommend having smaller but more frequent meals throughout the day, so you can make sure over the course of the day you're getting everything you need and not waiting until the end.
You mentioned that some people notice they're just not feeling hungry anymore. How can they make sure they're still getting that nutrition? How can they make sure they're eating those small meals regularly enough without waiting for those hunger cues?
Right. So not waiting for the hunger cues is the biggest thing. It's so funny because as dietitians, we typically teach people how to listen to those hunger cues. But now in this instance, it becomes more of honestly eating on a schedule and eating with more intention. This is one of those areas where having support from a dietitian can be helpful to see where you need to, if you need guidance or to where you need to bridge those nutrient gaps. But making sure that every time you're eating, every 2 to 4 hours, you're having something that's protein forward. Ideally, you can ask yourself, do I have a plant on my plate? That means you're getting some of those fiber and vitamins that you're missing.
One concern a lot of people have is losing muscle along with fat. How can nutrition help preserve that lean muscle mass?
This is honestly the most important thing that nutrition can do in this instance. When people are in a calorie deficit, it's easy to accidentally undereat on protein. And we want to make sure that of the weight that's being lost, it's fat that we're losing, right? Not muscle. Muscle it's the engine that keeps everything running. It keeps your metabolism running. It keeps your insulin sensitivity strong. Obviously, it allows you to get up off the floor and be able to do the things that you want to do in your life and not be frail. So prioritizing keeping that muscle mass on by making sure you're having enough protein throughout the course of the day, but truly breaking it up throughout the day in these small little meals is the best way to go about it. So you're consistently stimulating that muscle protein synthesis, right? That building of the muscle.
Can that help with preventing bone loss as well?
Yes, so the more muscle you have, the better your bone density, as well as, when you're doing these lifestyle activities like strength training, and you're sleeping well, and you're prioritizing keeping your muscle on, those activities also help with preserving bone density. So it's kind of like, a happy snowball effect.
How can patients avoid relying solely on the medication and developing the healthy habits you've been mentioning?
Yeah, so I think the best thing is to view these medications as this really great tool in your toolbox. So for the period that people are on them, whether they're planning to get off later or they're planning to stay on them forever, it really doesn't matter. The period that you're on it, use this time to create these healthy habits. A lot of people say it's like the fog clears. They feel more in control around food, whether that's their cravings or they're able to eat smaller portions and just be in the driver's seat around their nutrition. And then when they're feeling better in their bodies, again, they're moving more. And hopefully with some intention, they're doing that strength training. When you have less weight, you sleep better. You wake up feeling more rested. So it's like a perfect environment to really instill these healthy habits. And that is what we teach in the Renew program is you have a health coach to help you really solidify these habits so that whatever happens down the road, if someone goes off medication or if they stay on it, it doesn't matter. They have this foundation of habits that are going to help them not only keep the weight off, but really optimize the results they get from it. We want to keep that muscle mass on, like I said before, because not only does it help you look more toned, right, and be able to do things, but it does help you keep your blood sugar lower. It does help you, keep your lipids in a healthy range. So it's like a wonderful opportunity to hardwire these habits.
What are some of the biggest mistakes you see people make when they start these medications?
So the biggest mistake nutritionally I see is when appetite is low, the easiest thing to grab are things like convenience foods, like crackers and pretzels and, these foods that you really don't have to think about. Mm-hmm. Because when you don't have much of an appetite, sometimes it's not all that appealing to cook, right? So if you're just on autopilot, just grabbing something, most of the time I see people grabbing very nutritionally empty foods. Mm-hmm. And that's not to say that you have to cook everything from scratch, but you do have to have a plan around what you're grabbing.
Makes sense. If the medication is eventually reduced or even discontinued, what habits will make the biggest difference in maintaining that weight loss so you don't have to go back on them?
Right. All the habits that every healthy person needs. So again, I can't stress enough the strength training, 2 to 4 times a week, ideally. Having a balanced plate, balanced between your proteins, your fiber, your grains, enjoying treats, but in moderation. You know, treats are things that we see as, they're not things that we should never have, but they're things that if we have them too often, they will pull us away from our goals. And really, these are things that everybody needs to practice. And sleep, I can't overemphasize sleep enough. Really, sleep is that first domino. You know, when we're not sleeping well, it's so hard to do the rest of those habits. So it's not any different than a regular healthy habit. I think just viewing this as a time where you can really focus on those is such a gift.
And lastly, what's one piece of advice you wish every patient starting these medications heard before they started them?
Don't view weight loss as the only measure of success. So of course, it's really exciting to see the weight come off, right? But we want to make sure it's fat coming off. And we want to make sure that we're keeping our muscle, we're keeping our strength, you're feeling good in your body. And there are ways to measure this. We can measure body composition. I always recommend someone get it measured before they start the medication and then periodically along the way. We do this in the Renew program with the InBody machine at HealthFit. Anybody is welcome to use that. You don't have to be in a program to use it. They can just, come to HealthFit and sign up to use it. But having an idea of where you're starting at and then tracking that progress beyond just the scale is the smartest way to do this.
Micah Ipri, thank you so much for joining us.
Thank you.
If you liked this episode of HealthCasts, please like and comment. Visit smh.com/podcast to listen to more experts talking about the health issues which matter to you. And as always, we encourage everyone in our community to visit smh.com. Have a great day.